Hello guys, welcome to the future of medical education. So basically what I did is that I cloned a digital professor of medicine, okay, that can basically act as your mentor, can tutor you and guide you through your medical education, whether you're a student, medical student, or a resident doctor, or just a general practitioner. She can guide you even during practice, help you make diagnosis, can even pretend to be your patient if you want to practice clinical scenarios, can diagnose your patients for you, all right? Can calculate for you, anything you want, can even tutor you on different topics. So let's hear from her.
Welcome, Doctor. I am Prof, your favorite professor of medicine. To begin, press start.
All right, so she says that to begin, I can press start, right? So I press the start button. Let's say I want her to tutor me. Let's say I'll give her a topic. I can pick atrial fibrillation. So in addition to just typing, I can also decide to talk. If I push this talk button, I can talk with her. All right, we can have a chat, like a friendly chat, right? We can talk. I can give her instructions from from my speech instead of typing, whatever I want, right? So
Here is a comprehensive outline for the topic of atrial fibrillation. Introduction. Definition. Epidemiology. Pathophysiology. Clinical presentation. 2. Etiology and risk factors. Age. Hypertension. Valvular heart disease. Coronary artery disease. Cardiomyopathy. Thyroid disease. Obesity. Alcohol consumption. Family history. 3. Diagnosis. Clinical findings. Electrocardiogram ECG. Echocardiography. Holter monitor. Event monitor. Blood tests. IV classification. Paroxysmal AF. Persistent AF. Long-standing persistent AF. Permanent AF. V management. Rate control. Rhythm control. Anticoagulation. Cardioversion. Ablation therapy. Hybrid therapy. VI complications. Stroke. Heart failure. Tachycardia-induced cardiomyopathy. Thromboembolism. Pulmonary embolism. Death. V. Prevention. Lifestyle modifications. Medications. Procedures. If you are ready, we can begin with the first heading on the list, Introduction. If you have a different preferred topic or reference, please let me know.
So once I type I'm ready, she starts cranking out the tutorials, right? So this is basically how it works. This is for tutorial aspect of it. If I'm done with learning whatever topic I want to learn, I can decide to test my knowledge, which means if I press on the start button, I can select quiz, right? But I don't want to do that now because she's still trying to create a tutorial for me and I really want to.
Great. Let's start with the first heading on the outline. Introduction. Definition. Atrial fibrillation AF is a type of cardiac arrhythmia characterized by rapid and irregular atrial electrical activity, resulting in a disorganized ventricular response. It is the most common sustained arrhythmia occurring in clinical practice, affecting over 33,500,000 people worldwide. Epidemiology. The prevalence of AF increases with age, affecting 0.5% of individuals younger than 50 years, 5% of those aged 65 to 75 years, and 10% of those aged 75 years and older. AF is more common in men than women. It is also associated with a higher incidence of other cardiovascular diseases, including hypertension, valvular heart disease, coronary artery disease, and heart failure. Pathophysiology. The pathophysiology of AF involves changes in atrial anatomy, electrophysiology, and cellular and molecular function. These changes result in atrial fibrosis, which creates a substrate for the initiation and maintenance of AF. AF is initiated by an ectopic focus or a re-entry circuit within the atria, which sets up a rapid and irregular electrical activity that is propagated to the ventricles, causing an irregular ventricular rhythm. Clinical presentation. Symptoms of AF can include palpitations, shortness of breath, chest discomfort, fatigue, and dizziness. However, many patients with AF are asymptomatic and are diagnosed incidentally on routine electrocardiography or during evaluation for other conditions. Do you have any questions, or would you like to move on to the next heading?
Alright, so this is basically how it goes. Now, because remember in the outline, it gave me introduction, etiology and risk factors, diagnosis, classification, management, complications, prevention, right? So now that we've done introduction, it means the next outline will be etiology and risk factors. And if I click on next, or if I just say next, I can either type, okay, let me say it. So if I type next, it's gonna go to the next heading, right, in the topic. So basically this is how it works. And for any other function in the app still, okay, so you can have a conversation with Prof.
Great. Let's move on to the second heading on the outline. 2. Etiology and risk factors. Age. AF is more commonly seen in older individuals, with prevalence increasing with age. Hypertension. Hypertension is a strong risk factor for AF, with a twofold increased risk in patients with hypertension. Valvular heart disease. Valvular heart disease, particularly rheumatic mitral stenosis, is a common cause of AF. Coronary artery disease. Coronary artery disease is also a risk factor for AF, particularly after myocardial infarction. Cardiomyopathy. Cardiomyopathies, specifically dilated cardiomyopathy, can lead to an increased risk of AF. Thyroid disease. Hyperthyroidism is a reversible cause of AF and can significantly increase the risk of AF. Hyperthyroidism, on the other hand, can lead to a decreased risk of AF. Obesity. Obesity is now considered an independent risk factor for the development of AF. Alcohol consumption. Alcohol consumption, particularly binge drinking, can increase the susceptibility to AF. Family history. A family history of AF has been found to increase the risk of developing AF. Do you have any questions, or do you want to move on to the next heading on the outline?
So if I want her to repeat what she said earlier, I can also click on replay.
Great. Let's move on to the second heading on the outline. 2. Etiology and risk factors.
So yeah, this is generally how it works. And I keep doing this until I get to the end of the topic, right? This is just the second heading, and I think there are up to 7 headings, and I can keep going. So this is one of the demonstrations. Next time, I'll demonstrate the quiz to you, and even clinical pairs. I can make her give me specific clinical pairs that are important for specific topics. I can make her simulate clinical scenarios. She can act as your patient and you talk with her just the same way you interact with your normal patients. Then I can make her diagnose, plan, prepare a treatment plan for your patient, do your calculations, your clinical calculations, or your EGFR, or your stroke scores, anything you want, right? Then difference, like to compare and contrast different topics. Drugs, can create an outline for you about a particular drug, from the mechanism of action to the side effects to the everything, dosages, right? Then career, you can have a career chat with her, and you can also have a normal general chat. Okay, just talk. Maybe you have something on your mind you want to lay off your chest. So I will demonstrate it further subsequently. Cheers.